My clock, it's 9 o'clock. So we will jump in. Not surprisingly, this is going to be one of our larger town halls, so we'll let people continue to join us. Good morning. My name is Clark Duncan, and I serve as Vice President for Economic Development at the Asheville Area Chamber of Commerce and the Economic Development Coalition for Asheville and Buncombe County. Let me start off by expressing my appreciation to each of you and to the level of collaboration that I've seen between our public and private sector throughout this public health crisis. It's really one of the silver linings of this very hard moment we're living through. And the town halls we're holding yesterday, today, and throughout this week are another example of how our county and our business community have worked together in the greater interest of our residents. So let's talk about what this meeting will be and what it won't be. This meeting is structured to give the Buncombe County Health Department the opportunity to listen to business owners directly about your ideas and best practices around safely conducting business as we continue to deal with the COVID-19 pandemic. It's also time for them to hear about the things that frankly we haven't figured out yet, whether it's where to obtain masks or sneeze shields or gloves, or how to ensure social distancing in our respective businesses, or any of the hundreds of other issues that business people have to deal with when operating a business during this time. It's also going to be about sharing best practices that you may have developed or think will work for your specific industry. And that's why we're holding these town halls by different industry sectors of the Asheville economy. And today, of course, is arts, recreation, and attractions across our region. What this meeting is not, unfortunately, it's not a time to lobby the health department about whether or when we reopen or not reopen. As much as we'd love to have a timeline for planning purposes, we just don't have one yet. We won't come away from this meeting with a deadline for when we should prepare to reopen. What we will get, however, is a better understanding of how those decisions are being made. At the Chamber and the Economic Development Coalition, we continue to partner with the county to communicate both policy and more specifically the data behind county public health policy making so that our business community can plan accordingly for all of our shared priority, which is a safe and healthy return of the economy. So we are recording these sessions and we'll be asking you to make use of the chat section, the chat feature to give your input. I believe we're gonna have over 100 folks on the call. So let's make sure to log any questions you may have in the chat feature. We'll circle back to those as much as possible. But that's gonna allow the health department to have a literal record and transcript of your thoughts. And we're doing 9 of these this week, so the transcript feature will certainly help them in recording all of that input. Today, we're going to hear from Fletcher Tove, Public Health Emergency Preparedness Director of Buncombe County. I can tell you Fletch has been working around the clock, as has the team at the county's Emergency Operations Center. Thank you for your service. And we've also asked representatives of industry to join us as conversation starters to maybe spark some ideas or common experiences that you've had or questions that you may want to pursue. And we will also ask a series of questions via this PowerPoint and ask you to respond in the chat feature so we do get that transcript. We hope that by doing this, we can identify any community-wide barriers that we need to address, that the health department will have a better context for decision-making about business reopening, and that you as an owner or business leader can start your preparations for reopening so you're ready when that day comes. I also want to let you know that what we're collecting here are ideas. Just because we discuss an idea, we like an idea, it doesn't guarantee it will make it into policy. It is the health department's responsibility to determine which ideas provide adequate safety. And I personally like to thank and commend the county for providing these listening sessions and for their partnerships as we plan for recovery. So let's get started. Looks like we've got a good growing number on the call. And let me throw the meeting over to Fletch Tove. Fletch, are you with us this morning?
Yes, I am. Can you hear me?
Great to hear from you. Could you offer the group an update on where things stand?
Yeah, so good morning, everyone. Just like to start off with a snapshot in time about where things stand currently. So last week, we got some good strategic direction from the state, from Governor Cooper and his COVID-19 task force. What we saw from Dr. Mandy Cohen was the metrics that they'll be using to determine when the time is right to start our reopening, and then what metrics they'll be analyzing as we phase open. What we're doing locally is trying to mimic those same metrics they're drawing at the state level within the Buncombe County, so we can get kind of a snapshot every day of what we're looking at here. The other thing at the state level, they've introduced recently is their three-pronged roadmap to a new normal. Three major strategies there. One is increased testing for everyone. Two is increasing our capacity for contact tracing, which means when somebody gets sick, we send a team out and find out everyone they've had close contact with over a 2-week period, and then find out, what the status of them is. And then the third prong is downward trends of all those metrics that they outlined earlier. And then the second half of that is Governor Cooper laid out his 3-phased planned reopening schedule. Phase 1 starting off with some really small lifting of restrictions. Phase 2, lifting his stay-home order and expanding mass gathering guidance and some commercial activity. And then phase 3, kind of getting us to that new normal. I do want to point out to everyone that each of those phases, it has a timeline that we're going to be in for a couple weeks. So even if everything goes best case scenario from here on forward, our time frame for getting back to phase 3 is sometime in July. So I just want everyone to be aware that we may start soon, but this isn't a May problem for us. This is a May, June, July process of reopening as it stands now per their guidance. And as always, the situation changes very fast, and that may change. But best case scenario, according to guidance right now, as we start phase 1 in the next couple of weeks, we're looking at phase 2 and phase 3 up until July. And so that's what we're kind of doing right now. Locally, our intent is to align with the governor's roadmap as much as possible. So in the next week or two, we'll be relaxing some of our restrictions where we've been more strict than the governor. And so to better align with him as he starts going through these phases. But as always, if we're waiting some more details on the governor's plan, the specific nuts and bolts about how those phases will work and play out. If something doesn't make sense locally, we'll do what's best for Buncombe County. But our intent is to align as much as possible with the governor's phases. And that's it for my update. I'm not sure if I have the next slide here, Heather. Nope.
Fletch, thank you for that. I'm sure we're going to have questions throughout, so we'll stay in touch with you. Let me throw the floor over to John Filman with the City of Asheville. John, thanks for all that your team has done. I understand you've got a number of resources that might be available to folks in the arts, culture, and attractions sector as well.
Thank you, Clark. Yeah, we absolutely do. We've been spending a good number of weeks now gathering all of the information that we can through both national and international sources. As you can imagine, the events industry, the area of recreation and concerts and performing arts, this is one of the hardest hit industries that may not be real visible to a lot of people right now, because those are considered often extracurricular activities and not one of the core things that people do. But we have developed a long list of resources. We have a Google group that is available for people to join that are in our industry, where we are sharing information weekly on resources like legal advice for events, predictions. We've got a product from the Event Safety Alliance coming out on May 11th, which would be guidelines that are scalable, smallest events opening first. That'll be due on May 11th. And that's a collaborative effort across all of the industry professionals worldwide. So I have a number of things I can share either today or independently with the community as far as what we know and what we believe are the best next steps for our community to help sustain and support. We're working to reopen. Industry experts are saying 18 months to 2 years until we return to 2019 levels. So that will require that our community be nimble and able to adapt and be thinking about plans to implement technology and new solutions. So we're here and available to help make that transition as people need that help.
John, thank you. And thanks also for the work I know the city has done on our farmers markets and getting those off the ground this spring. I know that was not an easy task. If you would also stay with us throughout the call, and we might get some questions to head back your way.
Sure, absolutely.
Great. Heather, let's move on. Let me also introduce a friend of mine. Kathleen Mosier joins us from the Biltmore Company. Kathleen and I have stayed in touch throughout the past 6-7 weeks now, and you have the unique challenge at the estate of being an attraction, hotel, lodging, and restaurant businesses, outdoor adventure and accommodations, in addition to some light manufacturing and distribution. So when you look at all the different parts of your organization, Kathleen, how are you approaching and planning for reopening and recovery?
Thanks, Clark, and thanks for having us. At the beginning of this crisis, which has been unprecedented for all of us from a health standpoint, also an unprecedented financial crisis for our company, we decided that we needed to get very clear about our areas of focus. And first and foremost, our priority was public safety for the community, but also for our guests and our employees. We also realized we have an economic responsibility that we had to think through. And we, as a great contributor to the tourism industry, that weighs heavily on us because we know that a lot of local businesses rely on that tourism industry to sustain themselves. We also know, as an employer of 2,700 people in this area, people's livelihood is also impacted by this. We have 2,200 employees that are currently not working. And that's a really painful time in our company. So we wanted to focus on how we could affect all of those areas. And we quickly decided to form a reopening task force that would focus on recovery, that would allow us to kind of plan for what is to come next. So we've been working through different scenarios for opening and for looking at how our operation might safely reopen for guests. We've been aligning that to guidance from CDC, from North Carolina Department of Health and Human Services, from Buncombe County Health and Human Services, as well as kind of guidance from government leaders, certainly Governor Cooper's phased reopening, and then we've been awaiting comment from Buncombe County, so that was really great to hear as well. At Biltmore, we are planners, and so if there's any advice I think that I would pass on right now is that use this time wisely to plan. It is in our DNA as a company. We plan, we red team things, we test things, and we're using this time to do that right now. The task force has been very focused on getting industry benchmarks from throughout the country. The sad news is we are not alone in this crisis. The silver lining of that, I think, is that we have a lot of other industries that we can lean into who are providing best practices and testing things. And we're looking at how we adapt those for the unique needs of the estate. And as you mentioned, our business covers a wide variety of industries. So we're looking at how do we safely welcome guests back in all of those guest experiences in partnership with our government and public health and safety officials. We are looking in places also, and this is another piece of advice that I think has been helpful to us, and just to share, we are looking outside of the tourism industry. So we are looking at places and businesses that don't necessarily align with Biltmore, but they're doing it well, and they're giving us some ideas for, hey, how might we adapt that and apply that as we welcome guests back. The task force is drawing from leaders throughout our company, and we have challenged those leaders to bring us their best creative thinking. We are innovative as a company, and so we're using this time to really innovate and to think about, could we be doing things better, and what might a new experience look like with kind of innovation as the fuel there. The other thing, you know.
Go ahead.
Yeah, we've got a tour. We're looking at things like tours, on-site communication planning. So what is our signage plan? How are we going to operate the park so that on our trails and in our park areas, that social distancing is in place? And as I mentioned, just looking at standard operating procedures across every part of our business.
That's exactly where I was going, is I think a lot of people on the call can identify with different parts of the estate, whether it's an outdoor attraction or a cultural feature or the gardens. And I appreciate the attention to national best practices, and I'm hoping that's what this conversation can steer towards. How, for example, are you all looking at social distancing in either indoor or outdoor parts of the estate? Well,
we're looking at both and, right? So we have parts of our company that have been in operation because they are deemed essential. And so we have been applying those, and I should say our best practice approach is both for visitors and for employees. And we're trying to align those areas so that our front of the house operations and our back of the house operations are aligned both with how we communicate them and the safety practices that we have in both of those areas. You know, we're looking at everything, Clark. Honestly, you know, I get emails frequently, and I know that our reopening task force does as well, photos from our own employees who are having experiences at Whole Foods or Starbucks or Trader Joe's, you know, signage in places like Lowe's and Home Depot. So these are not industries that necessarily align to Biltmore House, but they are standards that we are seeing that are working well. And I'm spending a lot of time scouring the media and scouring coverage of other companies who are in the same boat that we are in. We're looking a lot at hotels and their practices, the big chain hotels and what they're doing. And I honestly, just as a communicator, I looked at these companies consistently as the crisis was unfolding. Mm-hmm. You know, I didn't have to recreate the wheel then in terms of how to speak to our guests and what practices and things to communicate to them. And we're doing the same as we reopen.
And I appreciate it. And I think we all are trying to strike that balance between workplace safety and the safety of a visitor experience. What you said something that made me think of a question we got yesterday, I think in our healthcare feature, which is, can individual businesses, for example, if you have signage when you're welcome to the estate, you know, here are the guidelines that we're going to ask you to follow. And the question is, should businesses be thinking along those lines? And Fletch, I'll bring you into this. Where will county guidelines stop and start? And will businesses have the opportunity to enhance those or make, you know, additional requests of people that come into their place of business? Because I think it'll probably be a little bit of both. So what is the public guidance? And then how would you advise a business to also think about what guidance they would create for their specific place of business?
Yeah, so I think as long as whatever enhanced measures you have are equitable to everyone, like you can take those enhanced measures on your own beyond what the county does. The example that's been coming up is right now the local language and the state language on cloth face coverings is just a strong recommendation when you can't meet social distancing. If there's a store and you want to say like you to the public, you know, you can't come in the store unless you have some kind of face covering. You can do that. You just have to make sure, you know, if you're doing that, you're doing that for everyone. Right now, our intention at the county level is we're having this discussion, but I think as the state does it, I don't know if we're going to get to the point where it's mandated by some kind of ordinance, but it's just going to continue to be a strong recommendation when you're out in public, particularly in areas where you can't meet the 6 feet in close contact criteria, that you wear some kind of face covering. So that's an issue we're working through currently, trying to brainstorm through the best solution to that. But if we have the guidance that says, your industry can be open for this number of people per square feet, and you want to go less to that, that's your prerogative. You can say less people than that or whatever makes it comfortable in your store. You just need to make sure it's consistent and equitable.
And well communicated. I think Kathleen makes a good point of helping both your staff feel safe as well as your visitors, if you welcome visitors and residents into your place of business. But I think another question I know this group is going to have, and I see Julie from Fox and Otter has one that will likewise be on Kathleen's mind, which is this concept of gathering size, right? And part of that is social distancing, and part of that is how many of us can we have together in small groups. For example, whether you're conducting a tour of the estate or you're conducting an outdoor adventure in small or large group settings. What is the guidance today, and in which of these phases, how do you see that perhaps changing?
Right. So currently in Buncombe County, there's no public mass gatherings. We're looking at relaxing that to match the governor's guidance soon, which says up to 10 people. And the governor plans on keeping that 10-person limit through phase 1. And then probably in phase 2, he says relaxing that, I would imagine would go to 50 people, possibly 100. What we don't have clear guidance on from the governor yet is, is that 10 people or 50 people at 6-foot intervals, or does that means, they could resume like tour-like activities where they're in a group? So we're waiting for some guidance on that. So I don't have a really good answer for you there, but we're looking close at the mass gathering guidance issue. The reason we went to 0 is, the best and really only tool we have right now to stop the spread of this is our physical distancing. And we just really implemented it. I think it was successful. As you see our numbers compared to the other top 10 metropolitan areas in the state, we're the lowest. I think that's from our early and aggressive physical distancing measures. Was that what that's attributed to? So so the mass gathering we're looking at, waiting for some more guidance from the governor of how they'll enact that, because we want to from here on forward be aligning with him.
Thanks. And so we'll be looking towards phase 2 for that specific relaxation. I know there's probably a consensus on this call that guidance is appreciated. I think we want to be doing what's best and most effective. Appreciate flexibility, but at the same time, want to know that we're following the best guidance that science and the public health department has to offer us, and how to create those safe environments.
Okay, thanks.
Heather, what's on our next slide? Great. Let me ask Kathleen, just for starters, along your scenario planning for reopening, and thanks for everyone for your questions. I'm going to try to swing back to as many of those as possible. For people that have joined since we kicked off this morning, please do use the chat function to add questions you may have, as well as strategies or best practices that you think may work for your business. We are both recording the call and we're maintaining that chat feature. We can download that as a full transcript. So please continue to add your input there. If we don't get to all the questions, we're going to have that transcript. So much appreciated. Kathleen, one question that businesses of all sizes have is going to be personal protective equipment. And so I'm curious what your thoughts are around staff use of PPE, whether it's gloves, masks, whether it's surgical mask, or as Fletch says, cloth coverings, which are now kind of best practice out there. How have you thought about or planned for the need for PPE on the scale of the estate?
I would say that's probably one of our top priorities. We are already in that right now because we do have essential areas that have continued to operate since our closure. So we are using PPE in those areas. You know, as with everybody, it was a combination of what we could gather together in the early phases, some cloth masks, some, you know, masks like you would get at Home Depot or Lowe's. We now have, you know, purchasing departments really look at sourcing those. Our goal is to have the 30-day supply as recommended on hand at all times. So that, I would say, Clark, that's probably our largest priority, because we want our employees to feel safe and we want our guests to feel safe when they're interacting with our employees. How exactly that will phase in across the phases of opening, we're scenario planning that now, but it is our intention that we will have all of those things in place.
You know, a couple questions are popping up in the chat about availability of that sort of equipment.
Yeah.
You know, there are traditional sources, right, for textile, medical textile masks. If you're having a hard time identifying those online, try supplyconnector.org, which is a local North Carolina based platform that a lot of our outdoor product manufacturers are retooling to support and making things for. There's also a great suggestion in there. Our friend Patty Torno down in the River District apparently is leading a consortium of fabric artists in the River District that are creating masks. We might as well look good while we're masked up. So lots of different ways you can move forward in identifying that. Those, I think, are good practices, certainly, particularly when we're in this phase period of knowing that a health threat is still out there. There are a lot of specific questions on the chat about particularly enclosed spaces, Fletch. For example, think along the lines of Lazoom or brewery tours or trolley tours. Talk to us about your thoughts on sort of those enclosed spaces and transportation. Is it still 6 feet, 10 minutes? What's the best way to manage social distancing? Maybe even if you do have on a mask.
Yeah, so I think we still look at that close contact criteria, which is the 6 feet for an extended period of time. But I think when we're talking about those kind of services, I think that's probably going to be a phase 2, phase 3 kind of thing, where you could have commercial non-essential events where people can maintain a social distance will probably be phase 2, and then phase 3, those close quarters ones, possibly phase 2, will come in there. That's again, we're waiting for some more specifics on the governor's guidance. I'm looking at his guidance right now, and he just really a lot of generalities at that point. But I think what we would say is that just because you have a mask on doesn't kind of, the face coverings are more to protect other people, not yourself. And other people wearing their face coverings are to protect you from them. So those conditions where the first phase of opening would be things where people can go out with a mask and still maintain social distance. Phase 2 is where we probably see limited businesses where you can't necessarily keep that physical distance, but it's in short periods of time, relatively short. And then phase 3 would probably be those close contact where like it's the nature of the business necessitates close contact, 6 feet for 10 minutes or more. It's probably what that would look like.
Thank you. I see Sean from the Pub Cycle has a good line on masks. If people are interested, he's posted that in the chat feature, just to open that up at the bottom of your screen. We also had a question, Fletch, that maybe someone missed the early talk, just wondering if there's any timing laid out around those phases. And just to recap, it sounds like phase 1 changes we might anticipate in the next couple of weeks, with phase 2 and phase 3 stretching out best case scenario through June and July. And again,
that's correct. So the governor gave the metrics they're looking at to determine when it's time to reopen. Based on that, when we go to phase 1, it says is at least 2 to 3 weeks until we go into phase 2. And that's best case scenario. And then in phase 2, we expect to be in between 4 to 6 weeks before phase 3. So that's what I was telling people. Best case scenario, this is through May, June, July reopening sequence. So have those mindsets, and as we get details on what the phases are, we'll push those out and make a local plan. But also keep in mind that if the trends aren't where we need them to be, like that phase 2, instead of being 4 to 6 weeks, might be 6 or 8 weeks. That phase 1, instead of being 2 or 3 weeks, might be a month. So it's all going to be data driven, which is what we want. But we just need to understand that if the numbers aren't showing it, I think the governor will either have to revamp his plan, or he's just going to be consistent and, slow roll it.
No, I appreciate that. I think, we've all made sacrifices over the last couple of months, but I think it understands that data is it's helpful to understand that data is driving the decision making at the county. So thanks for sharing that.
Right. I also want to jump in real quick and say that, what was I going to say? Oh, so it's data driven, and I'm sure the governor and his team are, but we're also really curious and looking at what local states are doing, Tennessee, South Carolina, Georgia. We think, I think most of the country would agree, they're really early in jumping the gun on reopening to the extent they are, but we're still going to watch and see what their data trends show. And I expect the governor, if they're not showing the significant jumps in effect that we thought, he might accelerate his table, but we don't know that for sure. But I do want to just, what I've been telling all these groups is we are aware of the sacrifices the community has made over these last couple months, and we're painfully aware of the impacts our decisions have. But if we open too early and we have to revert back, or we let the disease, get another big jump, local community, we don't want to waste all the sacrifices and pain people have gone through to get us in this safe spot where we are. So that's a big factor we're aware of. Is like, we don't want to waste that sacrifice. So we want to be slow and deliberate in our reopening.
Yeah, exactly. As far as indicators that people on the call should be looking for in the paper and your press briefings, is it specifically local infection rates, or are we looking at what's going on around us in the Carolinas and Tennessee and Georgia that may be making plans on a different timetable? Is that a concern for you?
Absolutely. So the governor and Dr. Cohen put out their statewide metrics they're looking at to make decisions. We also have to remember, we have a lot of cases in Charlotte and over near Raleigh, but Greenville, which is much closer, has over around 700 cases. They're closer than Charlotte is. So they relaxed a lot of restrictions. We know Georgia has a lot of cases. Tennessee has their biggest jump in cases this week, and they're relaxing measures. So we're definitely keeping a close eye on that and seeing where their trends go, see if their relaxation of measures is going to have an impact on Western North Carolina. So that's what we've been saying, is we just need time. We need a couple weeks to see if their relaxations impact us, and then what their local trends look like. And I'm sure that will inform our local decision-making and the governor's decision-making.
Great. Thank you. I see our friend Sharon Tabor in Black Mountains asking about festivals in late summer. I bet she might have the Sourwood Festival in mind. And I think, Sharon, there might be some guidelines to look at how farmers markets have adapted to the current environment and how that might be staged. If you're talking about July, we might be into phase 3, which might have different guidelines in terms of tent spacing and vendor spacing in public social distancing. Kathleen, question for you. In terms of sanitation, best practices that you've looked at across the nation to other attractions and accommodations, what are you seeing there? And do you have any gaps or questions there that maybe Fletch might be able to advise us on in terms of how do we make sure that we are creating a clean space, that we're regularly sanitizing to encourage safety both for our staff as well as our visitors?
Thanks, Clark. We are, and I think a lot of our industry partners are going to be in a similar situation where we had already very high standard industry best practice sanitation efforts in place. So the change of that is certainly based on CDC guidance, is an increase in frequency, as well as looking very specifically at those very high touch areas, the turning over of rooms, things like that. So we are in the process right now of developing a manual, which will be our kind of manual for new normal, that will have standard operating procedures. A big part of that is also purchasing. So making sure that we have the cleaning supplies on hand, that they meet the chemical specificity that is required by the CDC and the health departments, the guidance that they have provided. So we're kind of on a parallel track there. One thing I did also want to point out is I recommend that everyone consider documenting very carefully how they are stepping up and changing procedures. We don't want to find ourselves in a situation where we're having to roll back, but we know this is a flexible situation and we all need to be able to adapt. And if you have a solid plan for rolling forward, stepping back for a week or two will be easier to do and then ramp up again. So that's just a piece of guidance that we are certainly going to be employing at Biltmore and might be helpful for others.
I think that's a great reminder. Plan the work and work the plan. Definitely going to be our way out of this. And thanks to Ellis Vaughn and Erica Koffler, who was reading my mind around this question of sanitation practices. Ellis from the county posted a website which links you directly to EPA and CDC guidance on disinfectants to use against the COVID-19. So there are guidelines out there. I'm curious, Tove, are we just pointing people to those? Sorry, Fletcher. Or are there like approved, laugh at me, Kathleen, come on, we got to roll with this. I have two first names, I get Duncan all the time. Are there a list of, for example, approved local janitorial services, people that are doing this well, or are we just asking them to follow this guidance?
We're just asking them to follow the guidance, and we're being consistent and pushing people to that CDC and EPA guidance that Ellis pushed out on chat. You can find a lot of best practices there, but there are several contractors locally who clean above and beyond that. I just do want to point out, though, that when you're cleaning, you can follow this guidance. You don't have – we've seen some people pay a lot of money to have a very extreme cleaning done, and it's not necessary. If you match the guidance the CDC is saying, that's effective using the right materials.
Okay.
So we've seen some people paying, thousands of dollars for some kind of deep clean that maybe is not necessary.
Right. This should not be a more expensive process. The materials are readily available to maintain the sanitation standards that CDC suggests. Yeah.
And real quick, I saw a couple questions. One from Scott Woody asking about no gatherings. So currently, based on our Buncombe County's last stay-home order, we have no public gatherings. We're looking to relax that shortly to 10 people to be in line with the governor's, because he's been at 10 the whole time. And then I saw another question pop up a little bit ago about the three-phase plan. Is this from Mark Hemphill? Is there other data criteria Buncombe County's using to make policy adjustments? Not really. We're trying to mimic the same data the state's pulling. They have data at a statewide level. Some of that data doesn't necessarily break down into the county level. So we're trying to extrapolate local data that will serve in place of that. But we're going to be using the same metrics that the state is, so we're in line to make decision making.
I also see a question from Erica Harrow. Again, talking about festivals, which clearly drive a lot of activity in summertime in Asheville. Erica, I'd recommend you reach out to John Filman, who is kind of our local festival guru in the city. John, will you share your contact information again? Maybe you could help share and sort of conduct some of those conversations offline.
Absolutely. Should I add that to the chat?
Oh, yeah, that'd be great.
Okay.
Yeah, I'm sure that that guidance is going to be evolving over the course of the summer. Um, so we do a lot of work in manufacturing. There are 300 plus manufacturers in Buncombe County, most of whom had to continue operations during the otherwise closures. And so I've been looking to them for some best practices on operational and workplace safety. One that I found really unique was this concept of health screening for their staff. There are several throughout Buncombe County that are using apps that nightly push out a very brief health questionnaire to workers. Are you symptomatic? Have you been following best practices in terms of physical distancing? Do you have a fever? And then you sort of record, you answer these sort of self-checks on a daily basis to come back in the morning. So it's an added layer of clearly self-identification, but asking ourselves those hard questions to make sure that we're not bringing symptoms back into the workplace. I think that's low-hanging fruit that we can all think about, particularly in smaller workplaces. Fletch, any guidance on temperatures is a question I've seen here in the chat, and one we get pretty often. People are concerned about can we take temperatures of the public that come into my small shop, or can I scan the a forehead temperature of an employee as they come into my place of business?
Right. So we get a lot of questions about thermometers and temperature taken as a screening. The best screening you can do is the questionnaires about symptoms, seeing people are feverish. If you could take temperatures and you have that for staff, I think 100.4, and Alice, you can correct me, is what we're looking at. But the issue is that half or maybe more than half the people who have COVID-19 aren't going to be displaying any kind of fever. So it's kind of going to be a false sense of security for them. Yeah, it will cut down on some of the numbers, but it could possibly be more detrimental, because if people are feeling other symptoms and they say, oh, I've only got a 99, or my temperature's fine, they're going to have this sense of security that they don't have a fever. So from public health, we're not pushing the thermometer and temperature screening, partly because of that, partly because of there's a scarcity and run on thermometers, just as there is everything else, and different qualities of thermometers will give different results.
Right.
But so for screening, though, we do recommend screening. There's some question resources about what kind of questions to ask, and they can be very short and simple. But a big key part of that is being as proactive as possible with staff, like doing it the night before. And then what we've seen locally is some people kind of have almost like a social contract with their staff that they're having them sign. Like as they come in and clock in to work every day, they're saying by clocking in, I'm saying I don't feel any symptoms and I'm protecting public health. Or we've seen it more extensive where people actually have to, on a daily basis, fill out a paper questionnaire, of the symptom tracker. So we've seen different levels of that. And it's definitely a best practice. The temperature taking, if you can do that with staff, it's good, but it's not ideal.
Ellis.
Yeah, Ellis, please chime in.
Yeah, I just would like to add to that I think it's really important that businesses really look at their employee sick leave policy, and having a really strong policy is going to be the best thing that you can do to protect your employees and the public.
And Ashley, Ellis, do you have a screening questionnaire? I know we've seen some, but we'll get one out to this group. Of what those might look like.
I'll get one and put it in the chat.
Yeah, thanks.
Thank you so much. Also saw a question from Mary about, for business that has developed their own workplace safety guidelines, what's your preferred approach in a county the size of Buncombe? Would you be in a position to vet those, or will you be making blanket workplace safety guidelines that we could try to mirror?
Yeah, so we're going to be doing blanket. We just don't have the capacity to vet, hundreds and thousands of those coming in. We tried that a little bit earlier when we went to our stay-at-home policy, and it was just too much to keep up with. So we'll be pushing more than pulling. Assuming that most people are going to be proactive and take that seriously on their own. We will be given some guidance, especially as we get more clarification from the state in creating, tools online with that. So maybe even like templates for people. So we're definitely looking at that.
I likewise, I know we're looking at pushing sort of a checklist for reopening and recovering out there, and I think that will incorporate some of that. A good question just popped up, Fletch, for either you or Ellis. Any HIPAA concerns about asking your employees these kind of general questions?
No, they're formatted to be general questions. I also want to point out when we're talking about that screening that the temperature checking is part of an overall solution of screening. Like the temperature check standing alone is not sufficient. It has to be coupled with the entire screening equation.
Seems like a good exercise. I mean, I think we've all tried to power through a day at work when we weren't feeling well. Now's not the time to do that. So it's good to keep ourselves honest as we move, particularly through these next 3 months when hopefully we find ourselves moving further and further away from the crisis. Heather, if you could move us on to the next slide in the interest of time. I do think it's an important conversation to ask everyone that's on the call this morning. I think we're definitely a little over 100 now. Any gaps or challenges you're seeing as an individual? I think we've talked a lot about the guidance and the planning that we'll be doing as individual businesses in this sector. But are you concerned, for example, about any gaps in that plan? We have been working for weeks with our healthcare community just and our emergency operations teams on the availability of PPE. I think, Fletch, it'd be helpful for you to talk about what you see coming in the supply chain. Do you think that is becoming more fluid? If business all of a sudden becomes a big consumer of personal protective gear, are they going to be able to find it in the marketplace? Right.
So there is still nationwide a scarcity of PPE. There's still supply chain issues. There's more resources coming into place, so that might flatten out eventually. But I do want to make the point that we still want to try to reserve true masks, PPE, surgical masks, ear loop masks, N95, N100 respirators for first responders and medical healthcare entities. So we're at public health at the county, we're being really careful using the language of masks versus face coverings. Because a face covering is what the CDC is recommending and what we're recommending out in public, which can be anything from like a bandana to a folded t-shirt to the hand stitch ones we've seen the community producing. And the advantage of those is that one, it frees up true PPE for first responders and medical providers. But two, you can wash those. So if you have 2 of those, you can cycle them day on, day off, and use them for weeks and months. Whereas traditional masks, you might get a week or 2 out of it, but it's going to eventually lose its form and integrity, and we're going to start as a nation burning through those really fast. So we asked everybody, and we're trying to coordinate this as well, to really look at those cloth face coverings of some variety that you can wash and reuse, for the duration.
Face coverings, that will be the new way we talk about that. Thank you. I also got a couple questions overnight that business owners were just wanting to make sure, and I think we've stated this, that it's okay for me to put a sign in my business requiring you to comply with, for example, face coverings to come into my place of business. I'm allowed to ask that of you if you're my employee and that's what I request, or you're my guest and you're coming into my place of business.
Yeah, you could be more restrictive. You can't be less restrictive. And you just it has to be consistent and equitable. And I think we're asking our lawyers to put up some more, to look into that and get some more guidance. But we've been getting that question a lot, particularly concerning how many people are allowed in a store. Because some people might want to, the criteria allows for more, they want to limit below that threshold. And about the face coverings, because right now, again, they're a strong recommendation. I don't think from the governor's guidance they're going to be mandated in the state level. So, but stores would have that discretion to say, you know, if you're coming into this store, you need to have some kind of face covering. And maybe if they're doing that, they would offer it as well.
Great, thank you. A question on Airbnb, on lodging that we'll get into probably very specific niche questions for places that offer lodging. Since this is a number of outdoor attractions are on this call, Fletch, there's also a really relevant question there about what if we're fully outdoors? Think about outdoor adventure, zip lining, think of all the things you can do out of doors on the Biltmore Estate. Is that a different set of guidance that we might see in Big One?
We might see some separate guidance, but I think one of the mistakes we've seen is that people focus on the activity itself and say, okay, this activity is outdoors, we're gonna be separated. But you know, you have to think about the whole continuum of that event. People arriving in cars together, whether people are going inside to, you know, gain access to it, activity. So again, we're waiting for some clarification from the governor of how that's gonna play out. But it is part of a consideration in our planning process. Being outside doesn't make it completely safe, but it does reduce some risk, particularly if you're spaced out. So we're discussing that and weighing all those factors in.
I have a big question here, and it might be a good one to end on because I think it's on everyone's mind. When we rely not only on residents and visitors for a lot of our accommodations and attractions, what is the county's thinking on sort of inviting visitation to Buncombe County, and how do we get there?
Right. So visitation from out of state and even in the state is a concern. We know initially a lot of our first cases came from people coming from New York, Florida, Georgia, bringing the disease here. So it is a significant concern, but we're also aware, you know, we need to get to a point eventually where we could get our tourism economy going again. I don't have an answer on a time frame for that right now. A lot of that will probably depend on the governor's guidance going forward, but please rest assured that that's every conversation we're having, that's a factor that weighs in as we're determining our decisions. We're painfully aware of, you know, the secondary impacts of these decisions on the economy, on small independent business, on big business. And so we're weighing those every conversation we have.
And I think the more we're able to think through these plans, these recovery plans, and about our own personal guidelines for safety and physical distancing that we can accommodate in our facilities, the faster we get there. So I appreciate everyone contributing to this conversation. Fletch, Ellis, Heather, all of our team at the county, thank you for making time to share your expertise with us. A couple things to offer the public here before we adjourn. Thank you so much for really aggressively sharing your thoughts in the chat session. All of those are being actively downloaded. But if you have questions or comments you have not had the ability to ask, please use the email address on the screen here, which is business@buncombecounty.org. They will be specifically looking for your input on workplace safety questions and safety guidelines for reopening. Business owners, there's a new survey that we have distributed that determine the issues you're addressing right now. You may recall in early March, we ran the first one, which provided a great snapshot of information from the business community that went directly to our elected officials locally and at the state level that are developing policies that will see us through this. So if you would, also visit the resources page there on the screen in front of you at ashevillechamber.org/coronavirus. Take the second survey. It's a great, again, snapshot in time now that we are 7 to 8 weeks into this to know where things stand, and it's just a good real-time information that we can share with elected officials and policymakers. Let me offer my personal thanks to Fletch, to John, to Kathleen for making time out of very, very busy schedules to be with us. Together we are more resilient. I, for one, have been greatly encouraged by the coming together and collaboration in this community during such challenging times. Thanks to everybody for joining us and sharing your collective wisdom on the call today. Thanks for our partners at Buncombe County who are working to keep us safe and healthy. If you are interested in other town halls, as I said, there will be 9 across different industry sectors here in Buncombe County. I believe that link was posted in the chat feature. Things are, for example, lodging, restaurants, personal services, professional services, retail and manufacturing are still yet to be held today and later on this week. Thanks everyone for joining, and have a great rest of your day.
Thank you.